which is in the soil, and it's a breakdown of uranium. You can't see it, you can't smell it, and you can't taste it. Did you know that there is a potentially silent cancer igniter lurking around you every day of your life, putting you at risk for the top 3 diagnoses in the United States? The top 3 diagnosed cancers in the United States? You wouldn't feel it, but it's cooking you from the inside out, making cancer cells, and you don't even know it. I just ended my shift at the hospital. Everyone was still alive after I left them, and they didn't have to go to the intensive care unit, thank God. I swear, I pray for this every time I go to the hospital. But I'm not so sure that they were feeling any better, since they were suffering from debilitating diseases that I had to treat them with loads of pain medication. We talked. I heard about the joys of their lives, everything that they missed in their lives, but I also heard about the daily struggles that they have and that they absolutely hated. It wasn't an easy one, and it never is for me when I go to the hospital. I truly empathize and sympathize with their pain, because they're stuck in a hospital, stuck in a room where they can't even get fresh air. So it wasn't an easy one, because I had to look at them face to face, eye to eye, and see their current struggle in the hospital. So during the shift, I was challenged by my patients' conditions due to several problems that they were experiencing. And that was primarily, on this shift, their body not getting enough fresh air. They were getting enough fresh oxygen, which always freaks me out, because even after 13 years of working as a bedside nurse in a hospital, I do not like giving CPR. Absolutely not. Even though I have to, if the time came to it, it's really painful for a person to get CPR because we're pressing on their chest. And more than that, it's scary for the healthcare providers because we don't know if they're going to make it out alive. And it's even worse when family members are standing by and they're outside of the room waiting to see or hear from you if their family's going to make it. So on this shift, my patients were constantly coughing, and the lack of oxygen and the constant coughing made them feel tired all the time. They were always fatigued. So they were basically suffocating, which is not fun. So it made me think today about a killer disease that I wanted to discuss with you, my YouTube family. Because even though we're so advanced in technology and medicine, the new age medicine is so scary. It may prolong your life, but it doesn't mean that you're going to live a quality life. There are so many side effects these medications and advanced surgical treatments can cause you. And what I witness most of the time is pain, discomfort, and depression. It's so unfortunate that the human body cannot sustain itself over a lifetime in the most perfect condition, and will eventually break down on us. But I think that for the most part, we can control how our body breaks down or how the engine fails us. Hey, baby. I think just being open-minded to new knowledge coming from different avenues and participating in preventative practices is basically key to getting deathly ill too soon. So I can only hope that with this presentation, you'll take away one key advice, even though I'll try to list a few for you. Let me first go over or explain to you how bad this disease is that I'm going to talk about, and that is lung cancer. Lung cancer is one of the top 3 diagnosed cancers in the United States and in previous years. Just take a look at this chart from 2000 to 2009, and also this chart from 2009 to 2013, as well as this chart from 2014 to 2019. I mean 2018. And finally, this diagram from 2024. Do you notice the trend? So since lung cancer is one of the leading cancers in this United States nation, I just wanted to present to you the top 2 preventative ways or methods that you can include in your life to avoid getting this cancer. So one preventative method you may already expect, and then the second one you may not even know about. I really, really want you to be hopeful that you will not be diagnosed with cancer in the lung down the line. And hopefully your loved ones and your family members also avoid this complicated disease with the help of my education. Therefore, let me explain this to you in the most simplest way. Let's start with an unsettling feeling. because I think that an unsettling feeling will let you know that you are capable of so much more. So how would one feel if you have lung cancer? Similar to what I had explained to you about my patients in the hospital this past shift, it's a really painful disease. You get pains in your chest, you have a really hard time breathing, you're coughing consistently, and you're pretty much always tired. It's not fun, and if you ever plan on doing things like hiking beautiful Machu Picchu one day, it's going to be unattainable. And if you're diagnosed with lung cancer, more than likely the doctor would recommend for you some type of surgical procedure. You'll end up having to think about whether you want to get chemotherapy or radiation, which then again is extremely uncomfortable. And I could think of 4 words to explain this, and that is sick, tired, foggy-minded, and diarrhea. Let's go over some stats now. What is the actual survival rate of getting lung cancer? Did you know that 50% of people who are diagnosed with lung cancer actually die from lung cancer? At least 50%. Some forms of lung cancer put you at an even greater risk of dying, but more than 50% die from the lung cancer itself. It's a slow and gradual disease, but then eventually it's going to get you one of these days. The most important part is the part that I want to cover, and it's what you can do to prevent yourself from getting lung cancer. Today, I want to go over the leading causes of lung cancer other than the well-known smoking. So we all know, and it's been in the public, that the #1 risk factor for getting lung cancer is smoking, or just being in a room or around people who smoke often and you're at risk for getting secondhand smoke. First intervention that I cannot emphasize to you enough is stop smoking. Period. What is the second highest risk factor? And people don't talk about this very often. But before I move on a side note, if you're already on the fast track to getting lung cancer because you're an avid smoker and you don't plan to quit, make sure you're not also taking beta carotene. As I was doing my research, I came across articles that emphasize the effects of taking beta carotene when you're smoking, and apparently it accelerates the growth of lung cancer. Okay, so this may shock you, but the second highest risk factor for you getting lung cancer can actually be found where you live, where you lay your head at night to rest every night, and you have no idea that it's around you. Because there is no way for you to detect it with your humanly senses, with your nose, your mouth, or your eyes. And this is radon from inside of your home. You're probably thinking, what is radon? I've never heard of it. And trust me, you're not the only one. I randomly surveyed 20 people, and each person that I asked if they knew what radon was, they had no idea. So let me educate you. What is radon? So radon is a radioactive gas. It's found inside of the soil. It's a byproduct of uranium, which is in the soil, and it's a breakdown of uranium. You can't see it, you can't smell it, and you can't taste it. So according to the United States Environmental Protection Agency, radon is the second leading cause of lung cancer in the United States.
It's the second leading cause of lung cancer in the United States.
And let me emphasize, it is the leading cause of lung cancer for those people who do not smoke. So here you can see a map from the Environmental Protection Agency of parts in the United States where radon levels are incredibly high, which is marked in red, and it is being emitted from right underneath our feet, right underneath our homes and our buildings. So outside, in the outdoors, radon is emitted from the ground and it disperses into the air. It doesn't cause any health problems because it's just going into the air and there's minimal inhalation through the mouth and the nose. However, this is the important part. Radon can enter your homes through cracks, the foundation, pumps, plumbing fixtures, and just any entry point from the ground into your home. It's been known that radon can be especially high in the basements, which makes sense because it's right above the ground and the radon can seep into the home through the ground cracks. So now that you know radon is deadly to our health, how do you know if radon is in your home? So the only way to know if radon is in your home is to test. So radon testing can be done with an in-home tester from a hardware store or online. So here I found several in-home tests you can purchase to monitor levels at home or wherever you go. And if you end up buying this radon tester and you have levels above 4 in your home, the Environmental Protection Agency actually recommends for you to get an in-home radon detection system. That way, if the levels go beyond the limits, you would be notified. So okay, now you know radon is not good for your health, and you found out ways to detect if it's in your home. Now, how would you get rid of radon in your home, in your livelihood, in your safe haven? So remember when I said to you, I hope you take away one key advice from me? Well, I think this may be the easiest one for you, and that is to increase the airflow in your home. So you can quickly get rid of radon in your home if you just open windows, you use fans and vents, and you get the air circulating inside of your home on a daily basis. So maybe you should make it a point to open the window at least 1 hour in the morning and 1 hour in the evening during the summers when it's potentially too hot. Or maybe just increments at a time, maybe 10 minutes here and 10 minutes there when the weather is too cold during the winter times. Because the key is to get fresh air circulating all the time and to make sure radon leaves the home. So the second tip to get radon from entering your home is to seal the cracks or gaps inside of your home. So the cracks and gaps on the floor in your home can cause radon gas to enter the home. So you'll have to use material like plaster or caulk. And if you don't know how to do this, maybe watch a YouTube tutorial, ask a friend, or just get a professional to come into the home and seal the cracks and gaps on the floor in your home. That's if you detected a high level of radon inside of your home. There are some professional companies that will help you install radon reduction equipment. And on top of that, with this radon reduction equipment, they will even install monitors. The monitor will alert you when there's a problem with the system to let you know that you've been protected. Okay, so that's the end of my discussion. Smoking and exposure to radon inside of your home can be a serious threat to your health, particularly your lung health. But I think that following these simple preventative measures or seeking professional help, such as expert advisement, you can significantly reduce your risk. Alright, so if you found this video helpful, please give it a thumbs up, share it with your friends and your family, and subscribe to the channel for more preventative care tips. Stay healthy, everyone. Bye!